Good morning, afternoon, evening, everyone. It's a pleasure to have all of you join us for the Together We Can webinar. A few housekeeping issues before we get started. Please submit your questions or comments to the panelists via the Q&A function. We'll be taking your comments and questions as soon as the discussion begins with the panelists. And secondly, please do tweet. You can follow at Institute_SI, which will be live tweeting, and please use the hashtag #TogetherWeCan. Thank you so much. So again, good morning, afternoon, and evening. My name is Sam Walthus. I oversee humanitarian response for American Jewish World Service, or AJWS, a human rights funder based in New York. We work in 18 countries globally to support marginalized people to realize their human rights. We've also been a supporter of the Institute on Statelessness and Inclusion for a few years and have great respect and admiration for their work and the critically important role they play in raising the visibility of stateless people and their experiences globally. With the rise of populism and xenophobia that we're all witnessing, protecting the right to nationality and addressing statelessness is more important now than ever. And now, with COVID-19, we're also seeing how stateless people have been disproportionately affected and ignored by mainstream responses, including not having access to healthcare services or any economic relief schemes provided by governments or other. Most recently, we've been particularly impressed with how ISI has responded to COVID through its creation of the COVID-19 Emergency Statelessness Fund, or CESF. They've used innovative ways to not only support groups with funds, but also to play an incredibly important bridge building role between activists, advocates, and other actors working on these issues globally. Today, we're joined by three esteemed panelists from all over the world who will describe the context in their various countries and how COVID has disproportionately affected communities who are stateless. We'll also hear from ISI's co-founder, Amal Dichikera, and from Martin Dunn, a social entrepreneur and activist who has this issue close to his heart. And throughout the webinar, we'll watch a few videos from Nepal, India, and Montenegro that will take us to see the amazing work that the fund is supporting. We're going to start by watching a brief video made by CAPN in Nepal. The Citizenship Affected Peoples Network has a membership of over 1,800 people affected by Nepal's gender discriminatory nationality law. Their project researches the impacts of COVID-19 on stateless communities and is producing a podcast to reach out to the community to address mental health and legal challenges they face and to raise awareness. Following the video, Amal is going to speak. Again, Amal is the co-founder and co-director of the Institute on Statelessness and Inclusion, a Sri Lankan human rights lawyer. Amal has worked on the right to nationality and statelessness for the past 12 years. Thanks so much.
Welcome to SOS, a podcast where we talk about the plight of people affected by citizenship. During this ongoing pandemic, stateless people are living in more agony than ever before. Nepal was in the verge of passing its citizenship bill when the pandemic hit, and the discussion was heating up when everything came to standstill.
In a patriarchal society, in a politics driven by xenophobia, in a country where economy is poor, where youths are left with no choice but to leave the country for foreign employment, where more than 5.4 million people live without citizenship, where the voices are drowned by the mainstream misogynistic politics, this is a war of a mother and her children. Our effort is to assure that the issue is not drowned in the light of pandemic. Our effort is to reach out to the voiceless, stateless people, to let them know that they are not forgotten, to reach out for mental well-being, to seek for legal counseling and support, to keep the data of vulnerable stateless people.
Above all, to close the gap and to tell our stories, to wake up the society from this injustice. We hope that you will join us in our journey. Thanks to ISI. SOS is now a dedicated podcast advocating for stateless people. Remember, there is no alternative to winning this fight.
Thank you, Sam, for the kind introduction, and thank you even more for all the wonderful support that AJWS and the partnership that AJWS has provided us and others working on the issue of statelessness over the years. And what a wonderful way to start this webinar with that little video clip from our partners in Nepal who are doing really incredible, inspiring work. Now, I'd like to start my little intervention here with a little story. At our work conference on statelessness last year, an empty white chair sat in the foyer. This chair represented the world's stateless, those who could not be at the conference which was about them because they were denied the right to travel. Over the course of the conference, some participants wrote the names of the absent on the chair, their colleagues who should have been there but could not. Now, if this conference was to be held today, that white chair would represent most of us. The conference happened in a world that was very different for those of us who do have a nationality. But for the stateless, it was the same world, just a world that has become a lot more difficult to live in. As COVID-19 continues to tighten its grasp on our societies, our imaginations, economies, healthcare systems, and our collective well-being, we are all adapting as best we can. The restrictions that those with nationalities face in this exceptional situation are restrictions that stateless people face as a norm. Most stateless people cannot travel, not for fear of spreading a pandemic, but for the sheer unfairness of systems that deny and exclude those who have been arbitrarily deprived of their nationality. Most have no job security or legal recourse to work, not because of any impending economic crisis, but because they are viewed as illegal by the racist, sexist, xenophobic societies they live in. Most do not receive the healthcare they should, not because systems are burdened beyond breaking point, but because their inherent dignity as human beings is persistently denied and ignored. It's a cliche to say that COVID-19 doesn't discriminate or respect borders, but our temporary restrictedness and vulnerability in its face compels us to confront our permanent privilege. It would be incredibly blind, though, to speak of COVID-19 as a great equalizer. If those of us who have a nationality, access to healthcare, and stable incomes can no longer travel or take our finances or health for granted, those who have no nationality are now more vulnerable than ever before. What chance does a stateless person in Malaysia have of receiving healthcare now? Can the stateless in the Netherlands access economic benefits? How can a Rohingya child in Bangladesh obtain vital information when they have been denied access to education? How can a Palestinian in Gaza practice social distancing? The inequalities which marginalize stateless people in normal times have only been heightened in this emergency. While the rest of the world battles COVID-19, the stateless battle COVID-19 and structural discrimination and societal prejudice and political disenfranchisement. It is in recognition of this reality, hardly known and poorly understood by many mainstream human rights, humanitarian and development actors, that we at ISI decided that we had to do something. After extensive consultations with partners, donors, and friends, we decided to step completely out of our own comfort zone to fundraise for and to implement the COVID-19 Emergency Statelessness Fund. Crucially for us and our partners, this fund isn't just about raising and sharing much needed resources for activists, lawyers, and others at the front line of the crisis. It is also about building a vibrant community, a consortium of partners and friends who can together achieve more than we would ever be able to in isolation, through learning from and sharing with each other, feeding off each other's energy and creativity, and engaging in joint action. Our message is really simple and straightforward. COVID-19 and state responses to it disproportionately impact stateless people around the world. It also brings into sharp focus the structural discrimination, exclusion, and marginalization that the stateless have always endured. Our response aims to address both the immediate crisis and the longer-term structural challenges. We at ISI are ever grateful to the donors who are supporting the fund. We are in awe of our partners for their tireless and amazing work. And we are proud of what we have collectively achieved so far. However, it is just a drop in the ocean. The need is massive, and we must all respond. We hope you will join us and support us in these efforts. And I welcome a vibrant discussion about this over this webinar. Thank you.
Thank you, Amal. Looking forward to continuing the discussion with all of you shortly. In the meantime, I have the great privilege of introducing Melinda Ann Charlini, who's the Program Officer of Foreign Spouses Support Group and manages the Malaysian Campaign for Equal Citizenship. Melinda is also an advisor for two global young feminist funding organizations, the Frida Fund and With and For Girls. FSSG, which Melinda is going to speak more about, advances, promotes, and protects the rights of foreign spouses married to Malaysian citizens and their children. Their project aims to gather evidence on and address the bureaucratic inconsistencies and specific challenges faced by Malaysians, their foreign spouses, and children during COVID-19. Over to you, Melinda, and welcome.
Hi, Sam. Thank you so much for the introduction. And hi, everyone. Melinda here. So as Sam rightly said, at FSSG, we work on citizenship rights and legal status. And the community we work with are Malaysians in transnational marriages, their non-citizen spouses and children. So currently, Malaysian citizenship laws and policies have a lot of inconsistencies. For instance, foreign spouses are often socioeconomically marginalized, and Malaysian women do not have equal rights to pass on citizenship to their children born overseas on an equal basis as Malaysian men. There is only a 0.01% chance of approval. During COVID-19, we realized that there were unique issues that have surfaced because of bureaucratic challenges, discriminatory citizenship laws and policies, and just a general lack of access to Malaysian legal status. Families were put in precarious situations with a disproportionate impact on women. The major issue we worked on was restriction in movement, and we call it state-enforced family separation. Some of the stories were really disturbing to the point where our co-founder Bina, who's among us today, couldn't sleep at night. We had a case of a Malaysian mother who gave birth to her child overseas. She's undergoing divorce, raising her child alone in Italy. She couldn't bring herself to board the repatriation flight to return to Malaysia because of the fact that the child does not have a certain legal status in Malaysia. We also had cases where non-citizen spouses and children of Malaysians were stranded overseas without being able to return to the country. Pregnant Malaysian women in Malaysia, like there was one of them who didn't know who would drive her to the hospital or also take care of her older children while she went into labor. And we also had another case of a foreign mother married to a Malaysian man. They were raising their newborn child from hotel room to hotel room, depleting their savings and missing out on doctor's appointment just because they cannot enter the country. We will also see an increase in the number of children born overseas, hence an increase in the number of children without an access to Malaysian citizenship, and in some cases, even rendering them stateless. Of course, the wider issue here is that these laws and policies are deeply rooted in patriarchy, classism, and xenophobia. The laws itself were drafted during colonial period and no longer apply to the era we live in. However, while some countries have gone on to reform these laws, Malaysia unfortunately still hasn't found the political will to do so. It's also really unfortunate that lately there's been a rise in xenophobic and racist sentiments among policymakers and the general public in Malaysia. And as a result of this, we find that our communities are put in very precarious situations just because they do not have a legal status that can grant them certainty to live in the country that they call home. During this time, we carried out multi-stakeholder engagements, inclusive of policymakers and affected persons themselves. However, navigating the change in government and political turmoil in the country, we had to be really strategic with the ways in which we reached out to stakeholders. We celebrate every small win that comes our ways, and the stories we hear of the support the community was able to receive during difficult times, these are our ultimate gratifications. And during this time, the support from ISI and the establishment of the consortium was a huge support and a blessing. And I think a major reason why is because of a general difficulty for us to secure support for the work we do. FSSG was established 10 years ago. However, this is only our second or third funder. This is because it's not often considered a majority issue. It's controversial. Citizenship is seen as a national security issue. And as someone, me, who has been only working with the organization for a year and a half now, I look at the efforts of our co-founder, a foreign spouse herself, who had to put through these efforts for 10 years, working on a voluntary basis while providing support to almost 15 to 17,000 people in similar situations. And I think to myself, why does it take so many years for the issues to be recognized on large platforms? And why does it take so many years for these organizations to be worthy of receiving funding? And as disappointed as I was writing grants after grants, the consortium really gave me hope. To see a convening of people working on similar issues, I think that means a lot for smaller organizations. There is a sense of community, solidarity, and I think most importantly, a sense of familiarity on the issues we work with. And that is why I'm really glad today that FSSG is part of the consortium. And I'm just really excited for what we can do as a global movement. Thanks.
Thank you, Melinda, for that inspirational introduction. As we all heard, CESF is doing much more than just providing funding, but this connectivity between activists and solidarity is critically important during this really difficult time. I'm now going to turn it over to India and to Ravi Himadri. Ravi heads the Development and Justice Initiative in India. The organization works with refugees, migrant workers, minority communities, and people at risk of statelessness. Ravi has worked with these communities in different parts of India for many, many years. We're going to watch a short clip on a project which documents how the National Registry of Citizens process in Assam, India has added an extra layer of vulnerability to those affected and has compounded the impact of COVID-19. And during the clip, just a reminder to all of you in the audience to submit your questions or comments via the Q&A function. Thanks so much.
My name is Safia. I live in Assam with my husband and 4 children. I was declared a foreigner and sent to a detention center in 2017. I was released in May this year but faced a lot of challenges. The bail amount was very high. My husband is illiterate, so a lawyer submitted documents for my release. Now, I have been released, but I faced a lot of difficulties in mandatory reporting to police. I had to walk 26 kilometers every week to the police station. My entire family is excluded from NRC, but we all have documents to prove that we are citizens of India.
Thousands like Safia are at risk of statelessness in Assam. The National Register of Citizens published last year excluded more than 1.9 million people. They face exclusion and discrimination from not only citizenship but also from social protection schemes and COVID response.
I am not aware of any COVID response schemes. My family faced a crisis of food over the last few months because we spend a lot of money on legal expenses and my husband has been unable to find work due to the lockdown and health issues. I am suffering from high blood pressure, but we don't have access to health services. I don't have a ration card nor a bank account and so did not receive money promised by the government. I may be sent back to the detention center after the pandemic.
Globally, stateless persons have become more vulnerable during the pandemic. Some of the exclusions faced by stateless persons are similar across different countries, and therefore the problem needs strong international networks and advocacy through CESF. As a member of the CESF Consortium, we at Development and Justice Initiative work to document the exclusions and discrimination faced by people at risk of statelessness and advocate for their inclusion in COVID response and social protection.
So the video we saw and the narration of the story of this person, she has been recently released from detention, and there were about before COVID, there were 1,000 persons in detention declared foreigners. Due to a Supreme Court order, about 600 have been released till now, and they are all facing a lot of problems. But that is only part of the story. The largest story in Assam is that of the National Register of Citizens, where 1.9 million have been excluded, and they all will have to go to the foreigner tribunals after the COVID is over. Now, during the COVID, there was no information with these with the people at risk of statelessness, so they had to face a lot of problems, and there are also structural exclusion issues because the state is not just satisfied with keeping them out of citizenship, but they also want to slowly deprive them of other rights. There have been some changes in land laws and things like that, and these people don't have access to subsidized food and COVID response. Also, they have been discriminated against and excluded from COVID response schemes. Children are impacted because children schools have during the COVID, schools have closed, and also because in the remote part of many of these people at risk of statelessness live in the remote river islands and river banks areas. And the NRC implementation in the last couple of years also destabilized and made ineffective the institutional arrangements of health and education delivery. So children are deeply impacted, and out of these 1.9 million who are excluded, at least about 45% of them can be expected to be children. That is their overall proportion in the overall population. Migrant workers are affected because migrant workers from Assam who were working outside the state of Assam, they returned during COVID, and they faced a lot of problems because they came back and they were discriminated against, and they did not have much livelihood to depend upon. And also, migrant workers from the remote districts who live in cities of Assam are discriminated against because those who come from the border districts in Bangladesh, the perception is that they are Bangladeshis, so they don't get much of the COVID response support from the government. So the thing is, there are root causes in the sense that the foreigner tribunals are what is declared foreigners are the problem, and that problem needs to be addressed. And there are also structural issues of exclusion from COVID response and access to social protection schemes. That also, so it's a huge problem in Assam, which needs to be addressed, and it is not something that is going to be addressed very soon. It will take a very long time. Thank you for all the support ISIG has given, and to AJWS and the Dunn Family Foundation. Thank you.
Thank you so much. Really important issues to highlight. We're now going to jump over to the Dominican Republic, and I'm going to introduce you to Charlotte Wiener. Charlotte is the daughter of a Haitian refugee and a French migrant. She's a human rights lawyer working on refugee, migrant, and stateless issues in France, the US, Martinique, and the Dominican Republic. She's currently working with the Caribbean Migrant Observatory, or OBMICA. Dominicans for Derecho is a platform of civil society organizations that fight for the right to a Dominican nationality. The project carried out by the platform as a whole involves mapping exclusion from state relief efforts and providing paralegal support to the community. Over to you, Charlotte.
Thank you, Sam. So good morning or good afternoon, wherever you might be in the world. It's a real pleasure to present to you today on behalf of the civil society platform Dominicanos por Derecho, which is Dominicans by Right, and that's based in the Dominican Republic. Let me start with a little context for the statelessness situation in the Dominican Republic. Imagine a country with decades of well-documented human rights abuses against migrant workers and their descendants, in this case, those of Haitian descent. At the same time, you have socio-political tension building up until 2013, when the Constitutional Tribunal decides a case that unleashes mass nationalization of Dominicans, mainly of Haitian ancestry. UNHCR noted that over 130,000 Dominican citizens were affected in that one fell judiciary swoop. The efforts of Dominican civil society organizations and their allies abroad, constrained as they were, led to the Dominican Congress approving Law 169-14, the so-called naturalization law, intended to remedy the situation for both those registered and those who had been stripped of Dominican papers going back to 1929, because it was retroactive, and those never registered, but who had the right to Dominican nationality under the Constitution when born, has been far from successful. An official study in 2018 on the descendants of migrants born here revealed that the population descended from 2 Haitian parents has a great deal of difficulty integrating because some 37% still do not have identity documents. This is the face of statelessness in the Dominican Republic. Today, the Dominican Republic has the largest stateless population in the Americas and is also the epicenter of the pandemic in the insular Caribbean. The country has been especially hard hit due to a combination of a poor health system, lack of political will, and mixed and confusing messages from the government. In this context, how can we ask stateless people to stay at home when they have to pay rent and feed their families, all the while unable to qualify for official social and financial assistance because you need documentation to qualify? How can we ask stateless people to socially distance when most live in small, overcrowded housing with shared toilet facilities? How can we ask stateless people to constantly wash their hands when many do not even have access to drinking water? Conditions for many stateless people in the Dominican Republic under COVID-19 are more dire than ever, both in rural areas and urban slums. Today, many Dominicans of Haitian ancestry who are beneficiaries of Law 169 continue to wait for their files to be processed. Others were unable to even apply, and so they remain without a path to a solution. Plus, civil registry disruption during COVID means even more difficulty obtaining birth registration and is sure to have collateral effects for the future. Not to mention the differential impact on women, according to testimonies on intra-family violence and gender-based violence under confinement conditions. So this is the situation that we're confronting here, and is exactly why we decided that we needed a project that would help us better understand the evolving needs of stateless people and develop appropriate longer-term engagement strategies. Our project with ISI is to document and map the specific cases of those excluded from state relief. The project sits within and contributes to a wider study on the impact of COVID-19 that involves, inter alia, mapping the impact of disruption to civil registries during the pandemic. And this wider study will serve as evidence of exclusion for advocacy with relevant stakeholders. In addition, the project also involves empowering stateless entrepreneurs to set up small businesses in order to demonstrate the importance of not only working on documentation issues, but also working on improving economic viability for stateless people. In conclusion, there's a window of opportunity with a new government in power here since August. The outgoing government decreed the naturalization of 750 children of Haitian origin. This transition gesture enables the new government to move forward while sidestepping ultra-nationalist pressure to backslide. Our platform is accompanying many beneficiaries of this decree to ensure that naturalization happens and to keep a foot in the door, pressing for dialogue with the authorities. The situation is incredibly complex, but civil society pushback is a reality. And with strategic international support and this wider consortium approach, which allows us to exchange best practices and learn from one another's mistakes and share energy, like Amal was saying, our efforts will be sure to gain even more traction to help those most in need. Thank you.
Thank you so much, Charlotte. There also, heads up, is a question about birth registration that's going to come up in the Q&A or during the chat. So you'll be well prepared to respond to that, I'm sure. I'm now we're gonna watch another video that takes place in Montenegro. This project is titled Walk With Us. It's a community-based Roma organization that fights for the rights of the Roma community in Montenegro. It documents the exclusion of the Roma community within Podgorica in order to better understand the state of statelessness within the country and how many people are actually being excluded from the COVID-19 relief efforts, and also advocates for change. Following the short clip, Martin Dunn is going to speak. Martin is a social entrepreneur and activist based in New York City. He's the founder and president of Dunn Development Corps, which develops affordable and supportive housing in New York, and is also a trustee of the Dunn Family Charitable Foundation.
Besim Harizi has a wife and 7 children. They all live in one room. House is old, in very poor condition. They live near the garbage dump. He collects secondary raw material to earn a living. His children never went to school. None of them have any document. They are all stateless, even though they live in Montenegro for 10 years. Our government doesn't recognize them as stateless because they have ground to claim citizenship somewhere else. He never received any relief package during the pandemic lockdown. Because he is invisible to our government, he never got food, water, medications provided by government. Our organizations, Walk With Us Piranamensa, was the only one to approach him and ask how can we help them survive. Police didn't give him any packages, but they did stop him to get out of the house to try and work and bring some food to the table. Police isolated the Roma settlement and Besim couldn't get out of the house for 2 months. With very little water and very little food, they barely survived. Besim is not the only one, and that is why we need to react urgently. With CESF project, we will map all stateless people in Podgorica who were beyond government's reliefs, make a compelling case study, and capture all the ways in which COVID enabled them to earn even a little as they do. We will push the government to start seeing these people and give them help they deserve. The change needs to be global, and we will work together with Consortium partner. Let's react now and make sure Besim and his family live normally.
Thank you, Sam, Amal, Melinda, Ravi, and Charlotte. Your work is incredible, and seeing your responses to the intersection of the twin crises of statelessness and COVID-19 is both humbling and inspiring. As a donor, we're committed to getting funds to frontline activists and to elevating the voices and the role of affected persons, to putting them at the forefront and in the leadership of the movements for change. And so we're very happy to be participating in this. We first began working with ISI on their initiative to foster a global statelessness movement through capacity development for statelessness activists and the establishment of a global NGO activist coalition. As I think you can see from their work on this emergency fund, central to ISI's vision was involving and empowering stateless persons to take the lead in advocating for the right to nationality, and also to reverse the historical dynamic of global action on statelessness, which has been in a top-down manner and which stateless persons have only been used in token roles. So when the pandemic hit, the COVID pandemic hit, and ISI began to organize their COVID response, we felt it was critical to support. The first step was their assessment report, their impact report, which they released in June. And if anyone hasn't read it, I encourage you to do so. It's a very compelling and comprehensive report that this follow-up work is addressing. And I'd just like to share some perspectives on this as a donor. One question a human rights funder faces is why support a humanitarian effort? Isn't that the role of governments and humanitarian organizations? And what this effort has clearly shown is that the global pandemic and the related policy measures are impacting not only the lives of stateless persons across the globe, but also impacting the movements and campaigns to promote the right to a nationality. And of course, for humanitarian funders who might normally focus more narrowly on relief, it's critical to understand the structural issues that need to be addressed, or we're going to be in the same situation again and again. Both are connected, and one cannot be done without the other. Of course, helping address emergency needs and directing humanitarian support as a stopgap while fighting to hold government and humanitarian agencies accountable, responding to some of the things that have compounded the impact on stateless persons and their organizations, while at the same time working on the long-range goals. But I think at the same time, the way ISI is approaching this is really part of part of building the foundation for the international movement they're trying to create. The true collaboration and jointly developing the project concepts, connecting activists who are facing similar issues for peer learning and support. Both Melinda and Charlotte referenced that solidarity and sharing and learning from each other's mistakes. It's so critical to building a movement, helping those frontline activists and affected persons access international actors, the media, levers of power, and of course, getting resources directly to the frontline organizations of affected persons. What Melinda shared about how hard it's been to get donors, to get money to the front lines is a critical part of ISI's long-term goals. In addition to building solidarity and a movement among stateless activists, this effort has also tried to strengthen collaborations and ties with other marginalized groups through an informal coalition of the excluded, ethnic, racial, and religious minorities, indigenous peoples, LGBTQ plus populations. I just want to share a quote from Beth Fernandez from the Sigrid Rousing Trust, which is in the impact report. As donors, we need to have a dialogue with all grantees about what they're currently doing on statelessness, as we would on gender or sexual orientation or other forms of identity. Statelessness is a core rights issue. Without citizenship, you cannot access a whole host of other rights. And so that's part of how we are also thinking about this as a donor. If we're funding in other areas, asking how that how you look at that with a citizenship, right to citizenship and statelessness lens. And I would add that it should not only be donors, but other stakeholders, United Nations, NGOs, governments. Stateless people are impacted by and could be benefited from many other areas of work, and this is all documented very well in ISI's impact report, protection work, development work, humanitarian work, of course, public health work, media work. And so it's important for us all to bring this perspective in all the work we do. Thank you.
Martin, thank you. I think we're in complete agreement with everything that you just said and emphasized. We're now just going to have an informal conversation with the panelists. Appreciate all of your questions and comments in the chat. Please continue to submit them via the Q&A function. I'm going to start actually with the comment I made earlier, and this is a question for all panelists. This is from Paola Pelletier from the DR. What strategies or measures or good practices are NGOs taking to face civil registries closure during COVID-19 when babies are born in hospitals or at home? So I'm going to start with you, Charlotte, since you noted this in your talk, and then we'll turn it over to whoever wants to speak next.
So thank you, Paola, for your question, which is a very good question. So in order to be able to create these best strategies, first we need to be able to map the impact of the disrupted civil registration. So civil registries were closed during the pandemic, and so registering births has become incredibly difficult. Late declarations definitely increase the risk of statelessness. And so what we plan on doing with ISI's help is to do some research in the South. We're going to have 50 interviewees where those interviewees will be migrants from the regularization plan, those that are not in the regularization plan, Dominicans of Haitian descent from Group A, those from Group B as well that are registered in the plan, those who are not registered in the plan, and Dominicans of Haitian descent without any documentation problems, in order to be able to have a wide scope on the issue. And what we'll do is we'll be trying to assess the impact to see what extent these people are forced into late declarations, which are dissuasive and onerous, costly. It's difficult because there's no transport, or in addition, there's problems with social distancing. Right now, some of the offices are still closed. So on the basis of this study, we'll be able to create these best practices. We'll be able to share them with the rest of the platform in order to be able to really have some real strategies to combat these issues. Thank you.
Thanks, Charlotte. Anybody else want to comment on birth registries? Amal?
Yeah, I mean, just to add to what Charlotte said, the issue of birth registration and the challenges around birth registration, they predate COVID-19. And I mean, there are huge issues around kind of raising the levels of birth registration and achieving universal birth registration targets. It's one of the kind of ambitions of the Sustainable Development Goals as well. But what we find is that when babies' births aren't registered, if those babies belong to communities that live in border areas or belong to racial or ethnic minorities or have a migration heritage, that for those children, the lack of their birth registration is actually going to become a problem in the future, and they are going to face a heightened risk of statelessness. If you're a child who belongs to the majority community and you don't have a birth registration, the authorities' approach is going to be, this is a child who was denied birth registration. Whereas if you belong to a minority, the likely approach is going to be one of suspicion, and do you really belong here? And this is why it's so important, even on an issue which seems to be a general mainstream development issue, to recognize that there are real underlying challenges related to discrimination and exclusion. And that is why it's really important for all of us working on these issues to come up with useful and strong strategies to raise this issue, both in times of crisis like in COVID-19, but also in normal times. And we have partners around the world who are doing some fantastic work on birth registration, including a number of Roma partners. We heard from Elvis on the Montenegro video. And I think it's a really important issue that deserves a lot more attention by mainstream development actors as well.
Excellent point. Thank you, Amal. Unless anyone has anything to add, I'm going to turn it over to Ravi in hopes that I can get him to turn his video on. We have a question specifically for you, Ravi. Will the NRC be implemented in other parts of India in the future?
Thank you, Sam. Yes, the government, it's not very clear. The government did talk about a similar kind of exercise across the country, and because of there is a whole lot of media campaign that there are a huge number of quote unquote illegal migrants from Bangladesh in the country, and they need to be weeded out, etc., and all that. So there was a media hype around it. The government talked about it, but the more important and very which something that puts risk to the minorities in the country is the other the Citizenship Amendment Act, which basically discriminates against Muslim migrants from Pakistan, Bangladesh and Afghanistan, and promises citizenship to all those other migrants who come from these three countries, picking up these three countries, leaving aside, whereas we have had a very large problem in Sri Lanka, where of course there are the people who face the war there are Hindus by and large. But so the government's politics is to discriminate against Muslims using this law. So it basically is to, because in Assam both Hindus and Muslims are excluded from the NRC. So the government wants to give citizenship to the Hindus, leaving aside Muslims. So the Citizenship Amendment Act, which was passed with the parliament, that is more problematic. Even the government's talking about conducting NRC across the country is highly problematic. How it is going to be done, nobody knows. But certainly, what is very clear is that minorities are the targets, if at all it happens. And we may see that a lot of minorities, migrant workers, and everybody else who may have may not have very good documentation of their citizenship will be suffering from this nationwide NRC if it comes about. But I wanted to say something else, if I have a couple of minutes, on the birth registrations. In Assam, of course, we have been following up on birth registrations as well. And we found, this is prior to COVID, and we found that there are a lot of, because it doesn't happen, birth registrations don't happen automatically. And a very large number of births in Assam are home deliveries. And so the head of the family has to go to a certain village functionary. And so it involves a lot of running about and documentation and taking the letter and things like that. So it certainly is not very hassle-free exercise. So and in Assam, the data shows that birth registrations are 90% at that pre-COVID times. So now with the COVID, when all systems have broken down, this is something that we will have to see what further layers of problems for birth registrations. But I agree with Amal that this is a huge problem that we need to address. Thank you.
Thank you, Ravi. Martin, I'm going to look to you for a minute because I believe you had a question for the panelists as well.
Yeah, I want to raise one thing that's in the report and ask for the panelists to give guidance. One of the things it says is we remind all stakeholders of the imperative to listen to, work with, and be guided by stateless activists and communities, and to be accountable them for actions and inaction during this time of crisis and beyond. And it's reversing the dynamic of funders asking their grantees to be accountable. How do we? What do you have to say to donors or other stakeholders about how we can be accountable to stateless people and other affected persons and their organizations?
That's a big question. I'm happy to take a first stab of it, but I think it'll be important that Melinda, Charlotte, and Ravi also come in on this. Thanks, Martin, for raising that. I mean, I think there are power imbalances and power structures which affect the way we work and affect the way we relate to each other, which often go unsaid and which need to be acknowledged. And this is certainly something that as an organization, we are trying to confront ourselves. We've found historically that we've felt more accountable to donors than to stateless populations around the world. And that's purely due to the power imbalance. It's not about anything else. Our mission is not to serve donors. Our mission is to address statelessness around the world. But we feel accountable to donors. And that shows that there's something fundamentally wrong with the kind of the general donor NGO relationship and dynamic, which needs to change. And I think one of the ways to change that is to recognize that whether we are donors or NGOs, ultimately we exist to further the human rights of people who face acute human rights violations. And it's them that we all need to ultimately be accountable to. And that is why I'm very excited about the way the statelessness field is collectively recognizing this. I think our COVID work is an example, but there are lots of other examples as well. And Martin, you alluded to this when you intervened before, which shows that I think we recognize that particularly given the historical and structural disadvantage that stateless people face, which make it even more difficult for stateless people to speak with a strong, resounding political voice in their countries. It's so important that we take a step back and recognize that our role is to listen to create the space for, often by backing away from that space ourselves, for people directly affected by statelessness. And I think this same rationale should apply to donors as well. And it should change the way donors and NGOs have conversations with each other. I personally enjoy conversations with donors when it's a conversation. And that's my experience both with AJWS and with the Dunn Family Foundation, where we try to tease out and puzzle out a problem together, and we try and address it. And that's a fantastic starting point. But I think we need to do more collectively to really recognize that this is not about us. And I think it's that mental shift that needs to happen in order for us to start really making change in an effective and sustainable way. But I would really love to hear what Sam and Melinda and Charlotte and Ravi have to say about this.
Yeah, Melinda, do you have anything to add? Because you noted this during your introduction earlier, kind of the power dynamic and the relationship you have with ISI and the CESF. So I don't know if you have anything you want to add to Amal's excellent point.
Yeah, I just wanted to echo what Amal said actually, because I think if it's one thing that's different with the CESF is the very horizontal relationship between the funder and the grantee partner. It's a very collaborative effort because we have multiple check-ins, and ISI is always mindful of the context that we are in. I think in that also, from what I've observed the past couple of check-ins, there's a lot of agency given to the organization themselves. So, there's taking into consideration local context, issues with security, especially with the increase in curtailing of freedom of expression. There's also a lot of room for growth with the funder instead of seeing a power imbalance, which is usually seen with a lot of funders. There's always a funder and then there's the grantee partner. But here we see something a little more horizontal, where there's room for exchange of information, and a room where there's a lot of room for empathy and understanding of issues from a very personal context. So I think that's what stands out from the CESF, in my personal opinion.
Thank you, Melinda. So I'm going to shift us for just a minute and remind all of you, when Amal introduced the consortium to all of us, he spoke about the fact that it is aiming to respond to long-term structural issues and structural inequalities, but also short-term humanitarian needs that come up and have been exacerbated as a result of COVID-19. So there is humanitarian provision in the fund. We are going to show a short clip of a video of a project that the CESF is supporting, and it's with the Nubian community in Kenya. So to monitor and respond to human rights violations, documentation issues, exclusion, and other challenges that members of the Nubian community have been facing during the pandemic, in order to provide an evidence-based approach for advocacy efforts towards the government to stop the discriminatory vetting process, which disadvantages the Nubians when applying for ID cards, to raise awareness of the scale of the problem more generally through media advocacy, and of course to raise awareness of COVID-19 within the community. The project also involves providing stopgap humanitarian relief, which I talked about earlier. I'm bringing this up specifically because we heard through the Q&A from the Hockey Center, which is an organization working with stateless people primarily on the coast of Kenya, who again have been disproportionately affected by COVID-19, and that they've received a very high number of requests for humanitarian assistance, and due to a lack of funding weren't able to provide. So hopefully we can show a little bit from this clip, and then we can also shift back over to Amal to speak to other projects and the goals of the consortium to expand and to be able to provide humanitarian relief and other support more widely and globally.
My name is Zara Khalid from Libyan Rights Forum. we had our activity for distribution. We wanted to assist those that we had interviews with them to at least try to alleviate the challenge that COVID-19 has presented to them. Some, due to lack of getting their IDs, they are not able to get the job opportunities presented by the government to the youth. So we thought this as an avenue to at least try to assist them in pushing forward with life. What we did is like we gave the applicants who were community members a summary of their interview, whatever that entails. Because when we were compiling the interviews, we found out that majority of them didn't know law. So we had to teach them law and the names of registration offices that they have to visit when they want to apply specific documents. For ID card, we told them that they don't need to go to the registration office because the registration office is like a general thing. So for the ID card, they need to go to the National Registration Bureau, and for birth certificate, they need to go to the civil registry, and for passport, they needed to go to immigration offices, which they didn't know at first. There were some applicants who had already given up with their application, but we gave them hope. We told them that they should not give up during this application, because if they give up, also their kids and their generation, they will lack these documents. Today we did our food distribution for ASI project, which basically wanted to see how COVID-19 has affected applicants during their registration. So we distributed food to 20 family members. The food comprised of wheat flour, maize flour, salt, tea bags, soap, milk, and oil. So alhamdulillah, we are very happy. It was very successful, and all the applicants got their food. As an organization, we are also happy, and we thank our development partner, ISI, for the contribution and the part they played in facilitating this, and also Nubian Rights Forum in enabling and putting all this together.
Great. So Amal, I'm going to turn it over to you because we know there's immense need globally. We're hearing from audience members that they too have organizations that have needs and are wondering how they could tap into this fund. But more specifically, if more funding was available to the groups already being supported, or also to bring more partners in the consortium, what kind of impact would that have? And what countries or regions could ISI support projects if additional resources became available?
Thank you, Sam. And just a quick note to all webinar participants who've indicated that they would be interested in collaborating and joining the consortium. Please do get in touch with our team. We will make note of your questions and we will reach out to you as well. But we're very happy to always have conversations with potential new partners. I think the Nubian Forum video, it really shows, I think what Martin was also mentioning, that it's often impossible to separate the humanitarian from the human rights. And this was a bit of a dilemma for us, if I'm to be honest, because as a human rights organization, we don't do humanitarian work. We are not geared to doing humanitarian work, and we certainly don't have the resources to do it. And we didn't want to put ourselves in a situation where we were raising expectations by advertising that we would be able to provide for humanitarian needs. But at the same time, after speaking with various partners around the world, we found that ultimately, if people don't have food on the table, that it's pointless talking about structural discrimination. And so what we're trying to do through the consortium is show how COVID-19 is exacerbating existing injustices and making life even more unbearable for a certain segment of society. And if necessary, filling in a very interim humanitarian crisis. But at the same time, what we're trying to do is then get the message across to humanitarian actors that you really need to step up to the plate and come in here because we are not equipped to do this long term. And so the hope is that development agencies, humanitarian agencies, governments will recognize that unless they also provide aid and relief to stateless people and people denied nationality, that their COVID response is not going to be complete. In terms of the fund itself and where we're going with it, we are very lucky with the donors we already have on board. So we also have funding from the Oak Foundation, from Waste House, from the Sigrid Housing Trust, and we have a total of around 180,000 euros at the moment. But if you compare that, while that's fantastic, if you weigh that up against the actual global need, there's a lot more that needs to be done. We are currently in conversation with Rohingya partners from Myanmar and Malaysia and Bangladesh. We have projects that are just about to start in the Central Asian countries. We have conversations with partners in Madagascar, in Tanzania, in South Africa, and a number of other countries around the world. But we are now in this really difficult position where we need to raise more money in order to be able to actually deliver on these conversations. For us, we don't see ourselves as a donor. We mainly see ourselves as a conduit between donors and our partners. And that's why the CESF is also such an exciting approach for us, because for us, what's really valuable is the consortium that we're able to build, and we're able to participate, as Melinda said, as equals in. But I mean, it's a request to anyone who has any ideas about where we can potentially get more support for the fund. We do need that support. And if we are able to get the support, you have already heard from 3 of our partners how much they've been able to do with very limited funding. Some of these projects that you heard of have only received 5,000 euro, believe it or not. Others have received a slightly bigger 20 to 25,000 euro, but that's the level of support that we are able to provide under this fund, given the scale of it. Just one more thing, I'm aware that I've been speaking for a while, but the other really important thing for us to try and do is, through this process, also help build direct links between our partners and donors, because this is an emergency response and it's a time-bound response. And through this response, we are able to support partners to do really important work, but we're also able to support partners who themselves are vulnerable, who themselves belong to, as Melinda said, communities and groups that historically have been denied funding. And so our hope is that the consortium is not just the implementing partners, but also the donors. And this may be donors who wouldn't support an organization like ISI, but who would provide direct support to activists, lawyers, and other actors directly in the field. And so we welcome donors, even if you are not in a position to directly support the fund, to have a conversation with us about a longer term engagement and dialogue and support with our partners, stateless activists and communities around the world.
Thank you, Amal. Very helpful. I'm hearing you say more funds are needed to help fill the huge gap that's out there. So for funders on this call, please take note. Melinda mentioned the value of connecting to others on working on similar issues in other places. It's something that brings tremendous hope and solidarity. Can the panelists say something more about the added value of the consortium aside from just the funds? Are there plans for sharing learning, methodologies, etc.? And why is working in this way as a consortium so valuable? Charlotte or Ravi, looking to you first, or even Melinda to respond.
Sure, I can respond. I think Dominicanos por Derecho can relate really firsthand to the importance of the consortium approach, because as a platform, we're well-versed in horizontal learning. However, we are a platform of Dominican-based organizations. And so the consortium, with all of the organizations around the world with the wealth of experiences that they bring to the table, is really sure to be able to expand this concept of horizontal learning, and will obviously, I think, include concepts that and practices and approaches that we may have never thought of, but that possibly can work for us. So I think it's good to have, that on our radar. In addition, the consortium is sure to help us with international exposure, which is always welcome. And that international exposure will ensure then that we'll have a return of national exposure. So I think the consortium approach is really valuable, and I think we're looking forward to all of the wonderful energy that will be circulating. Thank you.
Thanks, Charlotte. Ravi, I see you came off. You're back on with us. So do you have anything you want to add?
Yes, it's certainly, listening to experiences in other countries. I think there is at least a few things that we can learn here in India and in Assam in terms of the kind of exclusions that stateless persons across the globe are facing, and the problems they are facing, particularly during the COVID times, and the advocacy strategies that we can use. And advocacy is one, and of course the Nubian Rights Forum's presentation here, and the whole issue of humanitarian versus human rights, and how do we hold the governments responsible for humanitarian relief. So our efforts in Assam is to get the government to do it, and to document how freely and unjustly people who are at risk of statelessness are being excluded, and thereby try and get the government to do the humanitarian work. But in the meanwhile, we know that all these things will take time, and there is a climate of polarization there, and minorities are being discriminated. So it's not going to be easy. So we also have combined in our project, humanitarian support to the affected populations. And learning is certainly one thing that within CESF, since so many of us are in a way, trying to address issues which are somewhere similar, though exactly not the same in different contexts, have different problems, different histories, different kind of laws, and why people are being excluded. So Assam context is something very specific, but then there will be a lot of issues which are very common. And yes, we plan to document how we have been able to address the problems and share it with others, so that it becomes a mutual learning experience. Thank you.
Thank you, Ravi. Another question that was submitted, from the examples given of in-country problems, it seems like the common challenge is that stateless populations are invisible to the government, and in many cases also to humanitarian actors. What role can the consortium and its members play in educating global actors on this common problem and in helping them to see and to reach these excluded communities? Are there also wider advocacy efforts beyond the specific in-country work that we could engage in?
Go ahead.
No, I was going to say I don't want to be the person answering all the questions first, so please go ahead, Charlotte.
So yeah, no, I think it's really about humanizing these communities. It makes me think of this incredible poem by one of my favorite authors, Langston Hughes, where he questions what happens to a dream deferred. And with stateless people, we're also talking about people whose dreams have been deferred. And people can relate to that. We all have dreams. And in this case, you have these people who find themselves stateless by no fault of their own, and their dreams of becoming a doctor, an astronaut, a filmmaker, a lawyer, whatever their dreams may be, so many times, most times, they're completely blocked. In the Dominican Republic, we have sometimes this issue is mediatized when they're talking about professional athletes and who are recruited by international teams. And then when they want to go, they can't go. They can't accept the offer because they can't travel. And so, you know, what happens to these young people when they see that their dreams are deferred? A whole lot of suffering, a whole lot of suffering. And so this is why it's so incredibly important to support this work. It means supporting stateless people's dreams, but it also means supporting their contribution to society, recognizing their contribution to society. That's not to say, don't get me wrong, that's not to say that they're not contributing to society, because they are contributing, and on a very profound level, whether it be by their struggles to get better working conditions, which benefit us all, or their backbreaking labor in the sugar plantations, in the agricultural industry, the tourist industry, the free zones, domestic labor, whatever it be, they are contributing so much. And unfortunately, these activities aren't recognized because they aren't recognized as Dominican citizens. And I think this is a common issue for us all. So this recognition and really ensuring that people can relate to these situations, which on one level are human. And so that's what I have to say about that.
If I can add to that, Sam, if you don't mind. I mean, that's a beautiful answer, and I agree with everything that Charlotte said. But I think it's the framing of the question is interesting. And it talks about stateless people being invisible. And I would contend that it's actually that states and societies are blind to stateless people, or they are not blind to them, they are acutely aware of them, and the stateless people have targets on their backs. And both of these phenomena relate again to underlying issues of racism or xenophobia, patriarchy, you know, the big societal justice issues that we are contending with. And statelessness is a reminder to us as we are dealing with all of these global issues. And they're kind of confronting us with all of the politics happening around the world, whether you're in America or the UK or in India or the Philippines, wherever it may be, that people are made stateless for a reason. And that reason often is related to racism or xenophobia or misogyny. And when people are made stateless, one response is for the state to ignore you and to be blind to you. And the other response is for the state to continue to target you and to justify them targeting you on the basis of you not belonging. That's what happened to the Rohingya in Myanmar. They were made stateless, and then the Burmese state said they are not Burmese, they're Bangladeshi, which is a lie. And they use that as a justification for their treatment. The same thing is happening, yes, to a lesser degree, but still in a very acute way in the Dominican Republic and in other countries. And so I think we need to, yes, remind all of ourselves about the humanity, our common shared humanity, but we also need to challenge the historical and structural discrimination, which is what ultimately has made people stateless, and which is also a common denominator and a common factor in terms of all of the other struggles for race equality, sexual orientation equality, and I can go on. And which is why, as Martin said, it's really important for us to, you know, reach out across the aisle and start collaborating and working together with all of these different groups. I also have a question for Sam and Martin, if you don't mind, which somewhat relates to that point. And it's that our experience at ISI, and I'm sure our partners would agree with this, when we speak to donors, has often been a recognition from the donor that statelessness is an important issue, interest in often there's a lack of understanding of the issue, and then there's an education role that we have to play, and then a recognition that this is indeed an important issue. But when it comes to actually then translating that into a longer term partnership and support, the answer is often that statelessness doesn't fit within our priorities. Now, the reason it doesn't fit within donor priorities is because it was never on their radar to begin with. And I wonder what your advice would be to organizations who work on these issues, who see how statelessness relates so closely to child rights or race discrimination or migration, all of these big priorities, but somehow in the conversation, that is lost in translation, and it boils down to really important work, but we don't support statelessness.
I have a very simple thought, but then I'll turn it over to you, Martin. What's interesting in the conversations that I've had is that if you take it to the population and not the stateless bucket, so Dominicans of Haitian descent or the Rohingya, people are like, oh, that they don't connect that to the statelessness issue necessarily. They focus on the population. And so at least in our experience, when we have talked to donors about our work, we started with the communities or the populations and then raised it to the level of if this is statelessness or people without nationality. That's worked more or less for us. Martin?
Yeah, I mean, I think it is. It's a incredible challenge, and I think that there's a lot of misunderstandings, or people think of it more narrowly, like the Rohingya, or and they don't realize how widespread this is and how many different contexts. It's not just, people say, well, oh, that's a migration issue or a migrant issue, or it's this issue, and they don't. And I think actually, taking it to the specific population level, but the most important thing I think is connecting it and seeing how governments are using this as a tool of oppression and increasingly using it as another tool of oppression, and showing how the denying citizenship rights to women to pass on to their children, how that relates to forced expelling people from countries and all the other stuff. And one of the questions I was going to ask to some of you is how you're using, and I know the media sometimes plays a very negative role in promoting xenophobia and racism and fear mongering, but what role can potentially the media play and then how are you all using the media in trying to elevate or address this? And I'll admit that, even as we were working on things in Bangladesh with the Rohingya, I was unaware that we had a significant statelessness issue here in the United States. And so it was with great embarrassment that I learned that we have estimated 200,000 stateless people in the United States. And I want to give a shout out to the folks from United Stateless who are doing incredible work around that. I just assumed in my country that a group like United Stateless would be working on the issues in other countries. It'd be expatriate people working on issues in other countries, and not that we have a problem right here. And so I think we are blind. Amal, I love your thing. They're not invisible, we're blind, and we have to unblind ourselves. But I think the media could play an important role, and other actors, in kind of connecting these issues. And we really have to get other people working in other NGOs, to have a stateless lens. So it's a really challenging issue and a great question.
Yeah, thank you, Martin. And yes, shout out to the United Statelessness. Melinda, did you want to comment on the role of media?
Yes, actually I did, because FSSG really heavily relied on the media during the pandemic. I think a primary reason why is because we had a change in government right when the pandemic hit Malaysia. So what happened then was that we lost a lot of our major focal points in government, because in the past we had made allies in ministries, among civil servants, things like that. But when the government changed, it was very difficult for us to get the message across and lobby for policy changes or even temporary special measures. So instead, what we had to rely on was the media, and it really did play a huge role because we were constantly maintaining a media presence. Although it was a bit risky and dangerous, we did have to take that risk because it seemed like the only strategic way to get the message across. It did land us meetings with the immigration, who was a major stakeholder in the issue we were advocating for. However, with the rise in curtailing of freedom of expression and the xenophobic sentiments, like I mentioned in my intervention earlier, we were told to keep our tone lower and show the government in a positive light in the media. So we had to then re-strategize and find strategic ways to get the message across in the media, but not from us. So then what we did instead was actually try to find different allies, such as a really famous pediatric doctor in the country who spoke on the long-term effect of being away from family on children and women, things like that. So although we weren't technically allowed to be very visible in media after that, we tried to find different allies such as coalitions, networks, and other individual activists who have a good media presence. So yeah, to answer Martin's question, I think media plays a major role in terms of getting the message across, especially when you're just trying to navigate building rapport with the government or whatnot. Also, just quickly want to answer the previous question about how we take the issue to the global level. Just a very personal experience. Bina and I, the co-founder, and I were actually at the Beijing Plus 25 Asia Pacific Review last year in Bangkok. And we realized that there was no representation at all of the stateless community of people working on citizenship. So I think the responsibility is also on regional organizations or global organizations that actually work towards bringing these global or regional convenings to ensure that there's representation of the stateless community there. And finding ways, because we do understand that with the stateless community, there's a lot of freedom of movement. So I think it's putting the pressure on these regional and global organizations and ensuring that there's representation.
Great, thanks, Melinda. Second to last question, likely, and probably for you, Ravi, since it's South Asia specific, but doesn't have to be. Can someone from the panel shed a light on how we're working towards the SDGs and the promise to leave no one behind, specifically in South Asia? Big question.
Yeah, certainly. I mean, this is also another aspect, particularly in Assam, we have been looking at. Because what Assam situation represents is that people who are citizens now are suddenly being deprived of. I mean, that was the only legal identity they had earlier, and which they are suddenly now being deprived of. Now, if they are not citizens, what is their legal identity? And in SDGs, we have been focusing on SDG 16 and SDG 16.9, which clearly says that everyone will have a legal identity by 2030. So, and in India particularly, that is the only legal identity. I mean, for everything to access any government service, to go to a school, to go to a hospital, you need that identity. If you don't have that identity, your access to development. So all the SDGs in terms of education, health, equality, and economic opportunities, etc. Everything, most of it is not going to work out if so SDGs, particularly in Assam, are going to be very, very seriously impacted because people will not have access to development schemes. And I think particularly in other South Asian countries as well. I don't know about Nepal, how in terms of accessing services or going to a school, what citizenship matters. But certainly I think SDGs will have a very, very serious impact. Statelessness and citizenship stripping is going to have a very serious impact on SDGs. And it is already very clearly, particularly in Assam, we can see that on the contrary to the idea of leave no one behind, the government exercise seems to be aiming to, targeting people and leaving them behind. deliberately leaving them behind is what seems to be, and minorities particularly will be at the receiving end of all this.
Thank you, Ravi. I want to give, with only 3 minutes left, Ravi and Amal an opportunity to say any last words before I close about the fund or other, Amal.
Thank you so much, Sam, and thank you to all my fellow panelists. I must say, for us at ISI, it's been an absolute privilege to be able to facilitate this process. And we've learned a lot along the way. We've made mistakes. We've really put ourselves outside our comfort zone. And the response has been overwhelming. Partners, donors, committee members who are volunteering their time to look at applications and make decisions. People are coming together with incredible generosity of spirit, sharing their expertise, sharing their time, sharing their resources in order to get statelessness on the map in a way that it hasn't before. Not to sound opportunistic, but one of the ways in which COVID-19 can help with the issue is that it's really bringing to light some of the challenges which were hidden and which we couldn't have open conversations about. So I think it was Ravi who mentioned this when we had our first consortium meeting. He said that there's an opportunity here for us to through COVID-19 shed light on the problem of statelessness and engage in much longer term advocacy. And I fully agree with that sentiment of Ravi's, and that's something that we are committed to trying to do. So yes, the COVID-19 response, it's an emergency response, it's time-bound. It specifically kind of caters to this very unique situation we're all facing. But it's also not separate from the wider, longer-term work on statelessness. And that's where ultimately our attention must lie. Because through this COVID-19 work, we can address the emergency, but we can also show the hypocrisy and the inconsistency of the way states deal with stateless people, the way states respond to statelessness, and start really pushing for structural change. So that's what we're trying to do. Our role is to bring people together, to listen to stateless activists and communities, to try and ensure that increasingly more activists are able to speak at international forums, as Melinda mentioned. And we need to move together on this in order to be able to move forward, which is why it's really fantastic that, I mean, Sam and Martin as donors all have come on board this call, Ravi, Charlotte, and Melinda as partners all on this call. And I think this screen that I see right now, it's a good kind of reflection of how we can and must move forward together. And I hope we can hold on to that over the next months and years in order to start making a lasting impact. So thank you all again.
Thank you, Amal and Martin, Charlotte, Ravi, Melinda. You all are inspirational, doing amazing work. And of course to ISI, who does this with such humility and with a willingness to take risks that are so important during this time. And to use your quote, Charlotte, really an organization that's working with people whose dreams are being deferred. So let's not let that happen for much longer. So thank you, everybody. Thank you for joining us, and have a good night, afternoon, and day. Take care.